This morning, vision loss due to aging may be remedied by new eye drops. Joining me now is Dr. Gicheru of the American Academy of Ophthalmology. Dr. Gicheru, it's so great to see you. Thanks for joining us this morning.
Well, thank you so much for having me on. I'm a refractive surgeon here in Dallas, so we specialize in procedures to get patients out of glasses, and I'm honored to be here, and thanks for the invite.
Yeah, absolutely. And we're going to talk about, I actually brought my reading glasses because this is something I think near and dear to my heart and probably to your heart because you do a lot of this work. We tend to lose portions of our vision, doctor, as we age. And I think it's called presbyopia.
Presbyopia. It's a problem that most people, if you live long enough, will eventually endure. And it has to do with the fact that every part of our body ages. And presbyopia is caused by aging changes that happen in the lens of your eye. When we're born, that natural lens is clear and soft, and it's able to change shape to allow us to see far and near. At some point, typically in the early to mid 40s, that lens will start to harden, and we find ourselves kind of holding things further away to see them. It eventually gets to the point where the arm isn't quite long enough, and a lot of us will start using reading glasses, bifocals, and trifocals.
And according to the research, there's about 1.8 billion people around the world that live this. So it's not just an American phenomena; it is a human. It's a human phenomena.
Yeah, exactly. Right.
Yeah, I mean that's significant. Now, typically, how do you're a specialist in this area of ophthalmology? How would you typically treat somebody who has presbyopia?
So the easiest thing is glasses.
Yeah.
So that is usually reading glasses, bifocals, trifocals, depending on where in the presbyopia progression you are, because presbyopia does worsen as we get older.
Yeah.
So in some patients on the younger end of presbyopia, we will sometimes do something called monovision, where we fit contact lenses, one eye distance, one eye near.
Yeah.
In some other patients, we can fit multifocal contact lenses. Surgically, with LASIK, we can do monovision LASIK, which is again one eye near, one eye distance. And then the biggest exciting thing that we're doing now is a procedure called a refractive lens exchange, where we can remove the natural lens of the eye in a procedure very similar to cataract surgery. And then we'll put in something called a presbyopia correcting lens that corrects vision to give you good vision far, near, and intermediate distance. So there are many ways to treat it.
Yeah, it's certainly treatable from the less invasive up to the invasive. You were talking about the refractive surgery and LASIK. Let's step back though. How do I, other than, I'm holding a script here and obviously it's hard for me to read. How would my doctor, my ophthalmologist be able to test me for this, to be able to determine, hey, Jeff, you've hit your 40s. I'm not really 40, I'm 53, but I hit my 40s and you really should start thinking about X, Y, and Z. How do you
Exactly.
find
So
out
that can
about
be
it?
treated either by your ophthalmologist or your optometrist, right?
Okay.
And it's a common problem that all of us see on a daily basis, right?
And so this would be like you go for your typical annual eye exam. So they're looking for
Right.
pressure, the glaucoma pressure test. They're dilating and they do I think it's called the Jagger eye test, right? And
That is correct.
they hold it close and they just say, you suck. You made a J into a G. You need some help.
Right, exactly. And usually the patients will come in complaining of a change in their near vision. A lot of them will borrow their partner's reading glasses. That can
Yeah.
be another way to kind of discover it.
Yeah. And
Right.
there have been, you mentioned refractive. Let's talk about the development of new technologies. This is an exciting time. You've been in this field for a long time. This is probably a very exciting time in terms of research and development and technology in the field of ophthalmology, and in particular, presbyopia.
Right, that is correct.
And what types of advancements? I know one thing that I've read about are eye drops. Do those actually work? And how would that work relative to your glasses? Do they replace the glasses? Do they replace the contact lenses?
Right. So in 2021, there was a medication called Vuity that was FDA approved, and it's an eye drop that is a dilute version of an eye drop that we've used for many, many years for glaucoma called pilocarpine. And this drop will constrict your pupil and also affects the ciliary muscle, which is the muscle we use for focusing. And the thought was that it would help patients with their issues with presbyopia. Now, I am also in my 50s, and I actually used the drop in my eyes before we started the interview in the interest of science and journalism. I've
Right.
used it before. With my prescription and my age, it just gives a slight improvement in near vision. It's not like a profound change. And when I've used it before, it's also kind of a temporary change.
Right.
The nice thing about it for most patients is it will work relatively quickly, typically within about 15 minutes. You'll usually get anywhere from 6 to 9 or 10 hours of effect. But again, is it going to cure presbyopia? Absolutely not. But it will aid some patients in terms of improving the symptoms.
So it sounds like, oh, I was going to ask, just I'll let you finish, but in terms of, it sounds to me like almost like a bridge step to some of the others, like the refractive surgery and some other things like, hey, Dr. Gicheru, I may not want to invest completely in the refractive.
Right.
Let's try this. Sorry, go ahead.
Exactly. Yeah, I think that's where it would work best. I also feel it would work best maybe on patients on the younger side of presbyopia, maybe patients in their early to mid 40s. It probably would work a little bit better in patients who are a little bit nearsighted, like myself. But again, I think it's more of like a bridge step before we try something else. Because again, to me, the effect was relatively small. But again, I'm on the older side of presbyopia.
And look, I'm a wimp. I don't like any type of pain. Does it hurt to put the drop in? And look, I've accidentally put. I wear contact lenses. I think I told you, but
Right.
the audience may not know. I've accidentally dropped the cleaning solution in my eyes accidentally. That was extremely painful. Is this a painful drop to put in?
So when I put it in, it did burn for a few seconds. Obviously, that will vary from patient to patient. Yeah, so it does do that. Now, one of the issues is also there can be the potential for side effects.
Hmm.
Pilocarpine, when we were using it more regularly as a glaucoma medication, one of the things we would warn patients about is the risk of developing a headache. It's usually a brow ache, and it tends to be temporary. Um, but then there can also, and also you'll tend to see some issues with redness, which for most patients is temporary. But like any medication, there can be side effects, and so that's something to consider. Obviously, before you start using it, I definitely would seek the help of a professional, yeah, eye care provider, either an ophthalmologist or optometrist. In either case, it really has to be prescribed by either by a medical doctor or optometrist. So either way, you have to see a medical professional to get it.
And does it need to be a specialist within the field of ophthalmology or optometry?
Ideally, yes. Somebody who knows your eye, someone who already has assessed you for your risk of glaucoma, etc.
I want to kind of so I mean that's an important development. I want to go back to the refractive surgery a little bit more if we could talk about that. I'm sorry, refractive lens exchange. Let's talk about that because it sounds like that could be a permanent solution because what we talked about with the drops is more of a bridge solution. That's a permanent solution, is it not, doctor?
That could be definitely looked at as a more permanent correction of presbyopia. And in fact, the lenses we use are called presbyopia correcting lenses.
And does again, I'm a wimp. Does that I've heard that LASIK is painless.
Yes.
Is this a painless surgery? Are you knocked out? How do you go about
So you're
doing
the
the
way
look?
we do it in our practice, you're very relaxed. We'll give you a medication like Valium, so you're very, very relaxed. We'll use some eye drops to numb your eye, so you're not able to typically feel pain. You'll just feel typically pressure, like so. And a lot of patients worry, how am I going to keep my eyes open? And we use a little device called a lid speculum to hold your eyelids open. Most patients tend to be very comfortable. Pain is not something that we typically hear of, but obviously anything can happen with a procedure. But typically, on a routine case, we don't hear complaints of pain.
And who would be a candidate? So you mentioned the presbyopia drops. I'm going to call them typically for people kind of at the early stages of presbyopia. What about someone who in their 60s, 70s, 80s, 90s? Maybe they hit triple digits. Would this be an option for them?
They could try it, but I don't think you're going to be able to get as much of an effect with patients who are in the more advanced stages of presbyopia. And it has to do with the fact that as we age, we talked about the lens hardening and not being able to change shape quite as well. The older we get, the firmer the lens gets. And in fact, a cataract basically means that your lens has become very firm, very cloudy, to the point where it affects useful vision.
Yeah. Last question for you, doctor. I just want to kind of pull back a little bit. For our younger viewers out there, people talk a lot about screen time. Are there things we can do to prevent or protect our eyes? A lot of us are look, you and I are on a Zoom call right now. We all use our phones. Are there things that we should be aware of as potential patients to protect our eyes, both outdoors and indoors when using the computer?
So I think protecting your eyes from UV light, I think is helpful. With computers, there is such a thing as computer vision syndrome. And that part really has to do with the fact that when we focus on something like a computer for hours and hours and hours, it's been shown that our blink reflex actually decreases. And so those patients tend to be more prone to dry eyes.
Mm-hmm.
So for those patients, we usually will recommend using something like an over-the-counter artificial tear. I tell my patients, whenever you use a computer for a long period of time, just train yourself to maybe every 10 to 15 minutes, look out in the distance, blink a few times, and then go back to your work. And that seems to help.
Yeah. Got to protect them. You technically only get one set, right? I mean, I know
one set of two eyes.
One set of two eyes. So, you got to take care of them. Dr. Gicheru, we're going to have to leave it there. Thank you so much for joining us, sir. And we look forward to having you back again very soon.
Thank you so much. I appreciate it. Thank you.
And that wraps up this morning's episode. We're back again tomorrow, though. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.